Hi there, my name is Leeanna and I'm the pelvic health physiotherapist working here at Alpha Health Services, and I wanted to take a moment to talk to you about postpartum assessments. Usually most of my clients will come in around 6 to 8 weeks to be seen by myself once they've been cleared by their midwife or their obstetrician, and once it's been deemed that the tissues have healed at the around the vagina and the vaginal opening, as well as if there is a C-section, to ensure that those tissues have healed as well. And so just to give you a sense of what an assessment may entail, my clients will come in, we'll sit down, we spend the first bit of the assessment just going through some basic questions to understand how my clients' bowels are functioning, how their bladder is functioning, to if they have started sexual activity yet, how that experience has been, if there are any significant concerns with pain anywhere. This is a really helpful kind of baseline understanding. And then from there, what we do is I would initiate sort of a model sort of education session, again, to explain the pelvic floor muscles, to explain how pregnancy has a certain effect on our pelvis and our lumbopelvic area. And then what we'll do is initiate a little bit of an assessment of the movement of your spine, your hips, an external evaluation of how you're holding your body and how you move in and out of bed, how you might pick up your baby, how you may be breastfeeding if you're breastfeeding, looking at positions, and just how well you're moving around. And then what often involves in terms of the assessment is initiating a internal vaginal assessment and or rectal assessment, and this basically involves trying to understand how your pelvic floor muscles are functioning now after pregnancy. What is their flexibility? What is their strength? What is their endurance? What's your ability to engage and coordinate and contract these muscles? And that's a really helpful sort of baseline to start. And we also look at, is there any scar tissue? Were there any stitches that occurred around the perineum? And if so, how flexible are those tissues? Is there any scar tissue? Is there any need to do some scar mobilization? We also look for those who've had C-sections, how that tissue is moving. Is there any need to be doing some of that scar mobilization, gentle scar mobilization in that area? And the whole attempt and intent is to try to provide you with just a good understanding of some gentle general exercises that your body may benefit from at this timeline. And we also really want to establish goals. What are the really important things and activities that in the short term and long term that you're looking to get back to, so that we can try to address them and help get your body progressively prepared for those activities. So hopefully this gives you just a bit of a general understanding and expectation of that type of an assessment. And if you're interested in doing that and booking that, I would be great, and I'd love to see you. Please book with Alpha Health Services today.